Well, November is Bladder Health Awareness Month. We have Dr. Garrett Pullman here today from Cardiology to talk about overactive bladder. Thanks for being with us.
Thanks for having me.
Let's start off by defining what exactly is an overactive bladder.
Exactly. Overactive bladder, also known as OAB, entails symptoms of urinary frequency, urgency of urination, and sometimes urgent incontinence or not being able to make it to the bathroom on time.
Are many people affected by this condition?
Yes, over 37 million. That's 1 in 6 adults. More common than asthma and diabetes. It can affect both men and women and adults of all ages. Despite the high prevalence rate, only 1 out of every 12 individuals affected by OAB will seek out help.
Oh, okay. Well, it sounds like it could be awfully uncomfortable. What are the treatment options?
Sure. So some of the initial treatment options include behavioral changes such as bladder training, but also medications too that we start with. But after 6 months of being on some of these treatments, we're seeing that over 70% of people are not adherent to the therapy, either because of side effects from the medications, but also lack of efficacy.
Okay. Are there a lot of these individuals that still having difficulty with urinary incontinence despite the initial treatments then?
Sure. Well, the medications itself, they work more on the muscular component of the bladder, but the problem may be more related to the nerve activity, the abnormal communication between the bladder and the brain, which is why we consider alternative therapies such as sacral neuromodulation or interstim therapy for these individuals that continue to have difficulty.
Let's go more in depth. How exactly does that work?
Sure. Well, sacral neuromodulation or interstim therapy, it works by controlling symptoms by directly modulating nerve activity, which is different, again, from medications that work more on the muscular component of the bladder. Interstim therapy is an implantable system that works by delivering mild electrical pulses to the nerves that carry signals between the bladder and the brain, thus blocking some of those inappropriate signals to the bladder.
Okay. What is the first step, do you think, in getting this therapy from cardiology?
Sure. So the first step is we test before we treat. And so what is involved with that is using a temporary lead, and I have brought one here with me,
okay.
A temporary lead that is attached to an external stimulator, and we do a test period of 3 to 7 days, and if the patient has a positive result defined as more than a 50% improvement in their symptoms, then they would be a candidate for the long-term therapy, which would involve implantation of a pacemaker type battery and a similar lead which we had just shown you, and moving forward with that therapy.
All right. Well, we're out of time. Real quick, where are you from?
I grew up in Norfolk, Nebraska, and so I did my training in Colorado, so it's great to be back in Nebraska.
All right. Thank you so much. Very interesting information, and we are going to